Dr. Baliga here. The case scenario or multiple choice question discussed in this podcast is derived from an outstanding chapter on patient safety in Baliga's textbook of internal medicine, available at www.mastermedfacts.com. It's authored by Dr. Anjala V Tess MD, who is Associate Professor of Medicine at Harvard Medical School. She's a hospitalist in the Division of General Medicine and Primary Care, Department of Medicine at Beth Israel Deaconess Medical Center, Director of QI and Safety for GME at Beth Israel Deaconess Medical Center. During her second year as a hospitalist, she served as a Rapkin Fellow in Medical Education. She served as an Associate Program Director for the Internal Medicine Training Program, where she was in charge of quality and curriculum development. As a hospitalist, Dr. Tess currently teaches on medical wards and is Director of Education for the Hospitalist program. Dr. Eric J. Alper, MD, is Professor of Medicine at UMass Medical School. He completed his medical training and internal medicine at UMass Medical School. In 1996, he became the first hospitalist at UMass Medical Center and helped to create the Hospitalist program there. He was the Internal Medicine Clerkship Director from 1998 to 2007 and Patient Safety Officer for UMass Memorial Medical Center from 2003 to 2006. He is now Vice President and Chief Clinical Informatics Officer at UMass Memorial Health Center. He has received multiple teaching awards and has been recognized for numerous quality and patient safety improvements. A 65-year-old man presents with shortness of breath and is found to have a large pleural effusion. All of the following are indicated to improve safety except A. Using alcohol foam prior to examining the patient. B. Obtain informed consent prior to performing a thoracocentesis. C. Performing a timeout prior to performing a thoracocentesis. D. Having the X-ray present prior to performing a thoracocentesis. And E. Check the patient's wristband and specimen labels against one another prior to the procedure. And the answer is B. Obtain informed consent prior to performing thoracocentesis. Informed consent is an ethical obligation and is not indicated specifically for patient safety. Performing proper hand hygiene, performing a timeout, having the necessary information available at the time of procedure, verifying the patient's identity properly are all recommended by the Joint Commission National Patient Safety Goals. Patient safety risk areas include patient identification, communication, medication safety, procedural safety, infection prevention, falls, identification of risk, and diagnostic errors. Patient identification. Properly identify all patients prior to any medications, transfusions, and procedures. Communications. Communicate all critical test results in a timely fashion to the right person. Improve handoffs and eliminate use of prohibited abbreviations. Medication safety. Improve safety of anticoagulation medications. Label all medications. Prevent harm from look-alike and sound-alike medications. Procedural safety. Assure that the right procedure is being performed on the correct patient in the right location. Infection prevention. Reduce the incidence of hospital-acquired infections. Falls. Reduce the risk of falls. Identification of risk. Recognize patients at risk. And diagnostic errors. Education about premature closure and diagnostic support tools are key. The case discussed in this podcast is derived from Baliga's textbook of internal medicine from an outstanding chapter on patient safety authored by Dr. Anjala V Tess MD, Associate Professor of Medicine at Harvard Medical School, and she is a hospitalist in the Division of General Medicine and Primary Care, Department of Medicine at Beth Israel Deaconess Medical Center, BIDMC. She is also the Director of QI and Patient Safety for GME at Beth Israel Deaconess Medical Center in Boston. During her second year as a hospitalist, she served as a Rapkin Fellow in Medical Education. During this fellowship, Dr. Tess created a model to teach quality improvement to residents. She served as an Associate Program Director for the Internal Medicine Training Program, where she was in charge of quality and curriculum development. Dr. Tess currently teaches on the medical wards and is the Director of Education for the Hospitalist program. She has led faculty workshops in both curriculum development and patient safety education. She is currently co-director of SHM and AAIM's Quality and Safety Educators Academy. Dr. Eric J. Alper is MD FACP, SFHM, is a professor of medicine at UMass Medical School, where he also did his medical training and his internal medicine residency. In 1996, he became the first hospitalist at UMass Medical Center and helped to create the Hospitalist program there. He was the Internal Medicine Clerkship Director from 1998 to 2007 and the Patient Safety Officer for UMass Memorial Medical Center from 2003 to 2006. He is now the Vice President and the Chief Clinical Informatics Officer at UMass Memorial Healthcare. He has received multiple teaching awards and has been recognized for numerous quality and patient safety improvements.